Hello, doctors, and welcome back on the show, the Eight Figure Dentist Podcast. So, today we're going to answer a question that has been asked in one of my trainings, which is I want to increase my fees. How do I make sure I don't lose consults? So, here's what you want to know if you are considering raising your fees. Raising your fees alone without quote unquote justification will truly indeed render in lost case acceptance slash conversions. Okay. Meaning you can't just increase your fees and expect people to be like, oh yeah, no problem. Yes. Sounds amazing. I love you. Let's go. Yeah. You will obviously lose people. So how do you make sure you don't lose them? There has to be a reason why you are increasing your fees. Okay. And you've heard this from consultants and other trainings. When there's a value, when the patient sees the value, they will say yes, right? Like the money is not going to be an objection. Now, this whole trick, right? Or I guess not trick in terms of like we're trying to trick somebody unethically, but like the whole puzzle, the challenge is how do you communicate the value? And you mistakenly, I love you, but you mistakenly think that value is communicated through a very thorough clinical explanation. Like the more in detail you spend time explaining the treatment plan and answering all of the patient's questions and maybe giving them options, you think that's how you're creating value. Unfortunately, that's not the case. And I used to think the same thing. Listen, I'm not here on the ivory tower. Everything I'm teaching you is all of the mistakes I've made myself. But this is what you value as a doctor, but that's not what the consumer values, your patient. Okay, so let's step back. So then what's going on with my hair? So if you want to increase your fees, then what needs to happen first? How do you justify it? And that is what I teach inside of my whole coaching career, really, like how to build a boutique practice is something called a niche, meaning you want to start focusing on a very specific target audience. You have to focus on a specific technique or philosophy or modality or a device or a procedure that you want to become known as an expert. Okay. So figure out what it is for you. And if you need help, I have programs, the 8-Figure Practice, the Mastermind, private coaching. There are questions that you can ask yourself or help me ask you to figure that out. But you need to figure out what you want to become known for. You don't want to just be we're the best family dentist, we're the best orthodontist on the block. It's the same thing as having a restaurant that says we sell food. Can you imagine if you went to the store and they're like, or restaurant, all food? Like what kind of food? Is it Japanese? Is that Italian? Is that American? Like what food? It's not going to land for people, right? Is it French cuisine? You have to be specific. And I hear this from a lot of doctors, like, oh, I don't want to box myself in. You're only boxing yourself in for marketing. On the back end, whatever cases are coming through, if they don't need that specific thing that you're marketing, obviously you're not going to recommend that. You're going to recommend something else, what they truly need, right? But in order to increase perceived value, that's what you're trying to do. You need to increase the perceived value of your treatment. And sometimes it's not just perceived value, it's an actual monetary value. For example, again, let's do an orthodontist. Let's say you're an orthodontist like me, and you decide that you want to go all digital. You are sick and tired of repositioning, and you decide to do light force or Clowen or like some digital braces, right? Your lab bill is going to increase, right? Obviously, but that's how you bake it into your fees. Then you also present it like the perceived value backed up by the actual value is, listen, you are going to have fewer appointments. It's going to be less painful because I don't have to constantly remove your braces and put them in a different spot, right? You have to explain all of these steps. You're not going to miss appointments so much. You don't have to travel, the childcare, the staying in traffic, right? The emotional costs that they're paying, the cost with their time, with their job, all these things. That's why it's more expensive. Right? So that's one way to do it, like actually change something physically about your practice, like install CBCTs, or maybe you're a general dentist and you do these large cases all on access. Well, some doctors go and get training in anesthesia, right? Or maybe you have like an anesthesiologist on the team, right? That comes in like every single Friday and you do these cases, right? And like maybe you have some sort of contracted with them. So like the 5K for the anesthesia is built in your fees, right? You're increasing the value of what you're creating. You're not going to, when you have a complex case, you're not going to send them go to the ENT, you find yourself a surgeon, you find yourself a pros, you find yourself this and the other. And when you're ready, I'm here, right? You're providing more of like a white glove boutique service where you have created this infrastructure for them to have that experience. That renders higher fees. So when you communicate this to the patient in the consultation room, you're not going to lose cases. Okay, that's one way, perceived value, or actually like the actual physical value, right? The other one is the perceived value through the niche. Decide what you want to focus on. But even in these two examples, they're very niche examples, right? And sometimes doctors decide that, listen, I'm going to have an associate who does more of the bread and butter of my specialty, and I'm going to do more of these complex cases because I'm interested in them, or they're challenging and they're stimulating and I like how they're not cookie cutter, whatever that is. Or maybe you decide, listen, I want to be solo practicing and I'm really into this one thing. Okay, go all in. Then all your marketing needs to speak to it. And let's talk a little bit about marketing. I hear this all the time from doctors. I don't do any marketing. And then when I start asking them questions, they're like, oh yeah, I'm running late for a call because I just had lunch with a dentist. And I'm like, a referring dentist? Yeah. I'm like, that's called marketing, right? Marketing is not just paid ads. Marketing could be, there's only 4 types of marketing, right? Marketing to warm traffic, marketing to cold traffic, the paid ads, and content. There's always 4 things in every single business that we're doing. So you want to focus your marketing, be specific to that niche. If you are well known in the community and it's an office you have bought from somebody that's been there for decades, then chances are your main source of patients is word of mouth. Phenomenal. Now start telling other people that, hey, you know what? I am now specializing in these certain types of cases. You'll start become known for that. Then you can increase your fees. If you're a startup, social media is your best friend. Make sure that your website is AEO optimized, not just SEO. And if you don't know what it is, I think it's podcast number 71, where I talk all about it. And there's a worksheet as well. By the way, all of my podcasts come with worksheets. They come with the notes and the actionable steps so you can actually implement where you're listening, because the majority of people just listen and do nothing. And I want you to move the needle. And so I have these free worksheets for you that you can download in the show notes below. Okay. So if you are, let's say, a startup or you're newer and you have some social media presence, or half of your patients are coming from Google, first of all, when our clients tell me they're coming from Google, what do you mean by that? Do you mean Google Ads? Do you mean a website? Do you mean Yelp? Ask your patients. Dig a little bit deeper, right? Then you need to make sure that all the content, also known as copy is anything written or verbal that is communicating to the world about what you do. Okay, so make sure that all of your copy in social media speaks directly to that niche. Make sure that you have figured out unique referring partners. You don't just refer to whoever everybody in your specialty refers to. That's how if you've ever heard these terms, like you are in the red ocean and you want to create your own blue ocean where there's no competition. How do you do it? You have to do something differently. And the way you do it is through the niche. Okay. So bottom line, wrap up this episode is, how do you increase your fees without losing patients? Increase perceived value through a niche. Become known for something very specific. And how do you figure out a niche? I'm going to help you. I have an excellent program called the 8-Figure Practice. It is my marketing foundation for a boutique practice. And there are excellent questions to answer. And there is also live support. I have group calls associated with this training where you can come in and get these questions answered and figure out what it is that you want to be known for and who is your unique network of referring partners. You only need a couple of ones. We're going to think outside of the box that will refer you those patients. When they do, you can charge them higher fees because you're providing highly specialized treatment. And a good example I always bring of this is if you go to not a regular, but a general surgeon, right, that does gallbladder removal and appendectomies and just general surgery. If you go to that general surgeon, they have their fees. But if that surgeon wants to start making a lot more money, then they need to specialize as a cardiothoracic surgeon. Will you raise an eyebrow paying more to a cardiothoracic surgeon that only focuses on the heart? Of course not, because they're more narrow specialized. Luckily in dentistry, you don't have to go to these extra specialties a lot of the time. You can just kind of niche down, like specialty within the specialty. There are these micro things that you can do within your specialty. Like, for example, veneers. Your niche could be veneers if you're a general dentist. Your niche could be airway if you're an orthodontist, right? Your niche could be neurodivergent kiddos if you're a pediatric dentist, right? You want to have that specific niche. That's how you will start charging more, and you're not going to see drop in your conversions or case acceptance. All right, my friends, I hope that was very helpful, and I'll see you in the next episode. Bye, y'all.